This is Group 25's project on bipolar disorder. The heritability of bipolar disorder is 70%. This trait causes large mood swings that cause those affected to experience manic episodes of happiness and deep depression. For bipolar disorder 1, the lifetime prevalence among the general population is roughly 1%. For both types, it's roughly 2.4%. There are approximately 40 recorded SNPs associated with this disorder. The genes primarily affected by this are GSK3B, BCR, and TPH2. The protein encoded by GSK3B is a serine threonine kinase belonging to the glycogen synthase kinase subfamily. It is a negative regulator of glucose homeostasis and is involved in energy metabolism, inflammation, ER stress, and mitochondrial dysfunction, and ectopic pathways. Defects in this gene have been associated with Parkinson and Alzheimer's disease. This is coded in multiple different types of cells, including skeletal, stem, and pancreatic cells. The translocation that BCR is involved in produces a fusion protein which is encoded by the sequence from BCR and ABL, the gene chromosome 9 breakpoint. Although BCR-ABL fusion protein have been extensively studied, the function of the normal BCR gene product is not clear. The protein has serine threonine kinase activity as a GTPase activating protein for P21RAC. This gene is expressed in brain cells. The encoded protein for TPH2 catalyzes the first rate limiting step in the biosynthesis of serotonin, an important hormone and neurotransmitter. Mutations in this gene have been associated with psychiatric disease such as bipolar disorder and major depression. This gene is mainly found in the brain and the neural tube cells. It would make sense that variations that change the structure or gene expression of these proteins alter the effects of bipolar disorder, as they produce chemicals that affect depression like serotonin and cause other effects in neural and brain cells. Our chip designs. We will be testing for roughly 40 SNPs in total. RS140504 causes a 1.4 increased risk for bipolar disorder with those with the AA and AG genotypes. This SNP affects the BCR gene in ways that are unknown, but is possibly linked to bipolar disorder. RS11178997 is an SNP in TPH2, significantly reduced TPH2 transcriptional activity by 22 and 7% in cell lines that might have implications for the development and function of serotonergic system in the brain. Those with AA and AT genotype are at an unknown amount increased risk for having bipolar disease. Because this reduces the capacity of the serotonergic system in the brain, serotonin is not able to be processed in the same capacity that it is in the brain without this SNP. Serotonin deficiency can lead to depression, and this SNP causes a reduction in the capacity of the serotonergic system in the brain, so this SNP is logically responsible for depressive episodes experienced by those with the disorder. The benefits of our test are recognize changes in the gene that will increase the risk for having the disease. Patients can be aware of their disease, distinguish changes in the gene that are already seen, decide how serious a disease is, help the doctor in choosing leading medicine or treatment to utilize for certain individuals, also test infant babies for treatable diseases, and allows for a better idea of a person's chance for getting a specific mental disease or if it can be diagnosed based on his or her symptoms. The limitations of our test are uneasiness/stress that may increase for individuals diagnosed with this disorder. If tested positive, people may feel frustrated, discouraged, on edge, or blameworthy for the results. It can give a constrained amount of data for a possible acquired condition. The genetic tests frequently can't decide the seriousness or symptoms of the disorder will continue to advance. In addition, the medications that are needed to take for bipolar disorder can cause distress due to the fact that the patient thinks there's something wrong with them. Sometimes the genetic testing causes pressure inside a family since it can uncover data that can pertain to future family generations. The plausibility of heredity segregation can also cause concern in insurance or business for those who are considered bipolar. There's a 70% chance success for inheriting the disease. You can produce a false answer when taking the test, leading to the intake of unnecessary medications when you don't have the disorder. Some warnings are finding out that if you have this genetic disorder can be harmful to you because you can pass it on and it will be your fault. Financially, it will cost for the screenings, medicine, and therapy, or anything else your doctor thinks you need to treat this. One may not even want to be tested out of fear that they will be positive due to the negative effects that testing can have on the body, but it's important for anyone who has a slight percentage of the genetic disease for their family due to the high heritability. You may not want the test, but you can be pressured to take it because of the effects it would have on your family. It would be your responsibility, however, to take the test and learn the risk posed to yourself or others in your future family and generations.